what I'd like to do is give a quick introduction to who we are at Players Health really quick, and then kind of walk through the COVID screening application. And so at any given point, as I said before, if you all have any questions, don't hesitate to reach out in the chat section here. But my name, as I said before, my name is Tyrre Burks. I'm the founder and CEO of Players Health. I started Players Health out of my own personal journey. I was a former professional athlete before starting Players Health, and throughout that entire career, play football, I struggled with injuries. And so health and safety has always been a big focus for us here at Players Health. And our main goal and mission is to create the safest environment possible for an athlete to play the sport that they love. Today, we work with over 1,250 sports organizations today that span over 50,000 teams, well over 1 million athletes now. I'm really proud to say that. We've been around for about 5 years now, and we're really starting to see that growth happening. Here's some of the larger organizations we work with, the integrations that we have and partnerships. So we're really excited and happy to partner with H18 and to be able to offer this as a solution. And so before I get into the demo, I'd like to communicate that when it comes to Players Health, and we like to provide what is called a circle of care of risk services around organizations. So anything risk management related, we support organizations with. And so I always want to communicate that this isn't just a COVID response offering. When you think about risk management in your organizations, if you're wondering about health and safety guidelines, your concussion policy, code of conduct, your injury management software, abuse prevention, bullying, all of these things, aspects that you all worry and work towards making sure that your organization is better, we provide and support organizations with doing that. And so Rehab is an application. We have a direct integration with H18. This really helps the organizations manage their overall injuries, proper concussion return to play injury management. And then another big component is our abuse and misconduct reporting software, which allows you to now manage and make sure that you get one central location for where all of athletes, coaches, or students for that matter, to report any type of abuse or misconduct. That could be bullying, it could be emotional, it could be physical, it could be sexual. All of those can now be translated into one place where you as the administrator and with the help of Players Health, we can support you with making sure that you all are properly following proper safe sport guidelines, and you're getting those incidents investigated properly and get to the proper legal authorities if needed. And then all of this really leads to compliance. So there is a compliance component around what we provide for a lot of organizations and making sure all of your staff and everything is now compliant. What I'd like to show you today is specifically around what we're doing with the COVID app. So we partner with the company, and we have a direct integration with a company called Conduct. And this application allows you to now do proper pre-screening. And so one thing that we will share post this is we've done a return to play manual for a lot of organizations. This has been something that has been that's been requested by a lot of organizations around how do we go about returning our organization back to play? How do you completely assess the risk within your organization around return to play? What policies and protocols do you have in place? What are the phases of reentry? And then really getting to proper COVID screening and testing, if possible, if needed. And so what we're here to talk about specifically is the COVID-19 screening assessment. What I will communicate is that all of this is customizable. So the last thing I want you all to think is that you have to operate within a specific set of questions. The questions that I'm going to show as a part of this, demo is our test that I just created as a test user. Any type of questionnaire that you want to set up for your student athletes or parents for that matter, we can create it easily. I'll show you how easy it is to do that. And then we can set up the schedule for you to receive all of that very quickly. And so the first thing I like to do is really walk into the overall forms. So everything when it comes to screening, and we support a number of organizations in a lot of different ways. You may have a form, a lot of organizations, once you have your form and your daily attestation show up, when there is an alert, what does an organization do? How do they go about following that? We can support around that. But the way that it's set up is that I can create a new form very quickly. It's super easy for me to go in and create a form. I can put in the form, I can say what type of assessment it's going to be. So I just wanted to show you how easy it is for us to go in, create a form. So don't think that you have to operate within any guidelines around what questions you want to ask. Once you have your form set up, we customize the alerts that you have for a specific question. And so I'll go to my test account, and here's all of these are questions that I've loaded in. I'll show you another form that I created as well. And so there's no right or wrong answer in terms of how you set up your survey. We can customize it specifically to how your district or school wants to have all of your surveys set up. Once those are set up, you could have developed any following symptoms, coughing, and you can have this highlighted. Has anyone in immediate family come in close contact with daily or developed any symptoms, yes or no? And if they say yes to this, then that would be a flag. And I'll show what those flags look like either by a team basis or on an individual basis. If you're doing touchless thermometer checks before the athletes or students show up for a school or practice or a game, this is something that you can track all of that in there as well. So if there's a fever, they can put this. Of course, the maximum could be, the max could be 105, 103. If it's over, say, 101, then you'll get an alert. Also, please indicate stress level. These are other questions you may want to add, especially as athletes are now returning back to school, back to sport. Everyone's been under a very heightened amount of stress. Really getting an understanding of the mental assessment of all of your athletes may be something that you want to do from a mental health perspective. But all of that is trackable. Once those questions are set up, what will happen is you'll get a report. And I'll show you how frequent you can set those up. It's all customizable in terms of the report. But these are the reports that you'll get. And then you can go in and highlight an individual athlete. So I can look at Aaron McDonald's profile. I can see that he said yes to fever. He put in a temperature that was higher than the alert temperature we set up. He has headache, sore throat. These are all symptoms that he said yes to. This would be an athlete we may communicate to their parent that is not allowed to start practice after they've quarantined 14 days or have come back with a clear test and they're symptom free. All of these are things that we support in terms of setting up that protocol. But this is the individual view, and then this is the team report that you can view and see by team what this looks like. And of course, you can select it by a custom date or a set of weeks. And then one of the easiest things that you can do is really set up the scheduling of this. And so once you set up your scheduling, all we do is set up notifications. So what we would do is we'd load up your rosters for all of your teams. We can set it up by groups or members, individual members. And so it's super easy to go in and set up everything in a really, really easy way. Let me go back to my other. And then I can set up my notifications in a way that allows me to go in and set up for any user that I have. And I have to give user access, 1 second. And once I set up that user, I can put in COVID test. Whether this is reoccurring, when do I want this to happen? Do I want this to go out at 1 p.m., 1:15 p.m.? Do I want it to go out at 9 a.m. every Monday, Wednesday, Friday, or recommended? The recommendation is that anytime that they're going to show up for a practice, a game, school, that's when they should have to take an attestation before. And then, of course, there's a start and end time. That end date could be the end of the season. It could be end of the end of the school year. And then you can highlight both email and text messages. And so all of that you can go in and schedule. And as soon as they do that, they're going to get a notification via their phone. And I don't have it where I can show you from my phone, but I can show you really quick what this looks like. And so what you'll see is I get this notification via my phone, and I can just click on it. They'll get that every day, and then they pop right into the app from there. And so it's super easy for them to go in, highlight their specific we put in, all we do is collect the emails and the phone numbers of, if they're minors, the idea is that parents will be filling this out, or athletes. We do have some organizations that still have their athletes filling it out. From a liability perspective, we don't recommend that, but it can be completely up to your organization. And so let me double check and see if I have any questions so far. Yes, and so we can set it up where you can review all of your sessions at an administrator's level. The way that this whole thing is set up is that you're going to have your whole team set up for each of your teams. And so this is you going into the swimming, and here's all the athletes. You can see who's compliant and who's not. Every day they'll have to do that, their daily attestation. And so depending on what they put in, it'll have whether they either are compliant for their COVID screening or they're not. And so this is us tracking whether they're compliant or not. So as an administrator, you'll be able to highlight all of your teams and look at it as an organization, and then pull all of your compliant athletes and non-compliant athletes. Non-compliant, this alert doesn't mean that they said yes to a specific question or no to a specific question. It just means that they didn't fill out the attestation for that day that it was required. And then when you go in and look at the reports, you'll also be able to view those reports at an organization level and also at a team level. Hope I answered that. And so, and in terms of getting everything set up, we do all the heavy lifting for you. Luckily, because of our partnership with 8 to 18, we can pull the registration by team. All of those are uploaded into the system. As long as we have the parents' email and phone number, which 9 times out of 10 we would get via the registration, we would upload those into the system. And then all we would do is just set the notifications. And so once the notification's set, there's really no more work needed to do. It's really easy to set up. Once it's set up and you set your notifications, whether it's going to be, at 9:30 a.m. every Monday, Wednesday, Friday, once that's set up, everyone's going to get their notifications via SMS or email or both. And then you'll get a report every day that they're required. And you'll have that report, and then you'll see a flag for everyone that is not compliant per the day that you've requested those screens. And so, as I said before, it's a really simple and easy application. All of the forms are customizable. So what we would request is that you send us over the questionnaire and the waiver you want the parent to fill out on a daily basis. We would load that in, and then we would ask you for the schedule in which you would like all of the daily attestations to go out. Some of our organizations are going out on only going out on game day, or it goes out the day before game day. That's something we don't recommend. Anytime that they're reporting for practice, game or school, they should be doing an attestation from a liability perspective. And so it's completely up to you how often or how little you want to set up the attestations. You can have any questionnaire you want to set up for them to fill out, and then the reports are going to come to you every day or whenever you scheduled the reports to come to you based on the schedule you set up for those users. And so if the practice is at 3 o'clock every day, or you want those reports at 1 p.m. or say right before school starts at 8 a.m., you'll have the reports from the previous day prior to that. And so that's something we can work with you all individually on. And, you know, we support in terms of setting up policies and things like that. If there are questions around that, that is something we can support you all with. But we'll definitely make sure that Abigail and Kim have access to the COVID return to play manual. And then if there's any questions or you want to dive a bit deeper in terms of your specific needs for setting up the COVID response app, let me know. We'll make ourselves available. And so, as I said before, I've recorded this. It's not a long demo at all. It's really just to get everyone a really clear understanding around how simple it is to set up, how customizable the forms are, and then how customizable the reports are. So those reports are always going to be available for you. You'll be able to access them as an administrative level, and at a coach level, you'll be able to view it as a coach. Any other questions based on what I've shared there? Also, and so it says, will all coaches be able to pull up their phones prior to? Yes, they will be able to access this from their phone. So that is something. They'll have a login, and there is an iOS and Android app that they'll be able to access to view this. Any other questions? And so in terms of availability of the platform, it's available now. We can set organizations up as quickly as tomorrow. The process is pretty simple. We'll send over a statement of work, which will basically count the number of users that you're going to have go through the attestation. And once we have that information, we'll request all of your rosters and all of the contact details per the template that we'll send over to you. Once we get that template, we'll upload them into the system, and then we'll set the notification schedule. So once all of that is set up, we can definitely get into getting that out set up. And so outside of what I've shared about the COVID, I know there's some individuals that wanted to learn a little bit more about the rehab application. I'm going to shift gears from from the COVID app to the rehab application. Any other questions on the COVID app so far? And so there was a specific question around daily testing. So you'll be able to view, and I'll go back to show this screen really quick. You can do daily screens, no problem. And so you'll be able to view the screens by day. As we said before, when it comes to setting up the form, once you set the notifications, just the same form, they'll be filling it out. So it'll become redundant to the users very, very quickly. But as soon as we set that notification up, we can set it up recurring, and we can set this up Monday, Tuesday, Wednesday, Friday. And then we can have it starting, say, on the 30th. And then we can have this ending, this time next year if we wanted to. And so they'll get a notification the 30th of 2021. They'll get that every Monday, Wednesday, Friday. And so, of course, we would set the end time at a more realistic timeline. And we'd recommend doing that on a quarterly basis. And all we have to do is reset it to make sure that it's consistent. Because as states reopen, as things continue to progress, maybe this time next year we're not doing the attestations. Who knows? We may be still doing it, but you'll have the ability to be able to turn and change the start date of all of these really quickly. So students can access it from their phone. I think one of the things that we have not done a lot, especially in the case of minors, is that the students have been recommended not to do the daily attestation. it would be something that their parent would fill out. But also, that's something we're not in control over. We're definitely not policing it. So it's something that will depend on you to tell us how you want to implement it. So if you want to have student text messages, students going to the text messages for them to fill out the attestations, we'll do that. But it's highly recommended that parents do the attestations on behalf of their kid. And so they don't need to download an app to do this as well. They're just going to get a text message, and they're going to get, they're going to get an email. And so luckily, there's no need for them to download an app or prompt any large scale implementation or training. They're going to get a text message in their phone that says, you have to do the COVID response, the daily COVID-19 attestation/agreement. They click the link, it takes them in, they fill out the form, and they click save, and they're done. And then that'll just update in this report here. So there's no need for them to download any apps. They'll get the text message every day, or however frequent you set up the notification. And so we'll set that up ahead of time for you. If you all decide that you want to move forward, all we will need is rostering, contact information, email, phone number, and the schedule. And so once we get that set up, and then we have the form that's fully created, you all have approved that the form is how you want it to be, we'll do a few tests with you, and once we do that, then we'll go from there. And so I got one more question. That is a really good question. So there was a question specific to coaches. So you could set up a notifications a couple different ways. You can set it up by groups. And so if I go to this form, I can have my whole coaches section. So if I want to manage form access, it's really easy. I can go in here, and here's a set of athletes. I can set up groups as well. And so I can set up roles. Right now it's just athletes. I can set up a coach's role, and all of my coaches will have to go in and take the attestation. I can set up individual users. So I can say Tyrre Burks is going to be granted access once we set this up, and then all we do is start the notifications. So we already have me set up. I'll start the notification for the COVID test. I'll show this really quick. Right now, and I'll show you all that I'll receive a text message in a second. 1 second. I'm gonna say I'll just send this out immediately. And then I'm gonna get a text message. I'll schedule the notification. And once that is set, you're gonna see me get a text message, which I just got. And then from there, all I do is click the link, and then the form opens up on my phone. And so that process is super easy for anyone to follow. Let me make sure everyone can see my screen. But yeah, this is the form. All I did was click a link that I got from my messages. So that's all they're going to get. And then it takes them right to the form. Once they fill out the form and they answer all the questions, it'll fully update in the report. And then everything will be available for you as administrator to view. And so coaches can definitely do that. I don't know if coaches would fill it out on behalf of the athlete, though. That's definitely something that I don't know if they'll have the ability to do that, especially if parents out of town or not available for any reason. Maybe we can set up where the athlete would fill it out, but there's no ability for a coach to go in and fill out on behalf of the athlete. And I think it's built that way from a liability perspective, because if you have a waiver language that has them fill out or sign anything at the bottom, the idea that a coach would be taking on that liability on behalf of that kid, that's something that we don't see happen very often. That's a really good question. So one of the questions we got was that, do parents create an account, or do the email phone numbers put in by the administration? So the process in which we would hope is that parent register for their kid to sign up for activities via 8 to 18 registration. 8 to 18 send us the organization sends us the registration data. We upload it according to the daily attestation schedule, and then we'll name the athlete with the parent's phone number. And so that's how the parents will create the profile for you. But the idea is that it will come via the registration when they register their kid for activities. And that would be the easiest way to take as much administrative burden off. And if you don't use the registration part of 8 to 18, all we would do is just request a roster of your parents and your athletes, of course. If you have a rostering functionality of some sort for any of those users, we would just request the roster data if you're not using 8 to 18's registration system at this point. And the format is pretty simple. It's really athlete first name and last name, phone number, email, team. That is all. That's the only data, or organization name and team. But the organization name would be the same for everyone, but we would just want to know the team that they're a part of. So that if you wanted to give coaches administrative access to view their team, they'd have the ability to be able to do so. And there's definitely not a requirement for you to have coaches be able to view. A lot of our organizations don't even have their coaches be able to log in. It's only done at an administrative level. We just want to create the most flexible administrative access points for you. So in the one-off that you do want to give your coaches access, because you've given us the roster by team, we can now filter by team and give those coaches access to those athletes. Yeah, these are really good questions, though. Thank you. And so I'll reiterate really quickly before we move on, just to see if it sparks any other questions we have. Really quick, we can set up the form. That's customizable for you to go in and set up. We set notifications really easily. Those are set up once. If they do change, they can be quickly changed. So definitely no cause for alarm on that. You can set them up daily. You can set them up, every other day. You can set them up once a week. You can be as customizable as you want for the scheduling. You can set text message and email. They'll receive it. And then once you receive it, you're going to have your COVID screening report. You can have that done by team. You can have that done by the entire organization, or you can have that done by the individual report for a specific user. And so all of that is there for you to access, and you'll be able to review that on a daily basis. You can also go back and look at previous dates of the assessment per an individual, per team, per your organization. So you'll always have the ability to go back and view. If you ever need to pull data, you can download it all, and you'll have access if you need it for proof at all that you've done this in any way. Yes, we could easily do this for all of your student population. So we could create up a student list, and all of the students would be required to have the attestation filled out prior to. As you can see, this isn't a sports-driven application. Yes, I am talking in context of athletics because that's what we do here at Players Health, but you could easily set this up. And as you can see, the attestation can be named anything. As you can see, I went in, I changed the form. I can create a form specific to all students, and I can say student daily COVID-19 attestation / agreement. I can set that up right now. Everyone would receive it, and everyone would be able to do it. So you could definitely create it and set up for all of your students. And I think one thing we would want to make sure is that we get 2 access points. We get both email and we get text message. So we wouldn't just have one access point for them to fill out the form. Perfect. And so, yeah, that took perfect amount of time. And so what I'll do is I'm going to transition to the rehab application really quickly, and then I know we'll definitely get some questions specific to that. And so one of the things that we've done specific to the rehab application is really around injury management. Over the years, Players Health has become one of the more dominant health management applications in the market. There's a couple reasons why we've done that, why that has been the case. Number one, we've made something very easy to use, very simple, and mobile accessible. So there is an iOS and Android application for you to log in. You can use your 8 to 18 credentials to log into to your form. And yes, the COVID app would be an additional cost for over the top of the Players Health platform. And depending on the pricing we have set up, so if you decided to pick up the Players Health Rehab Platform and you still wanted the COVID app, it would be a reduced price. So the normal price for the COVID app is 75 cents an athlete a year or user a year. If you wanted to have the Players Health Rehab application as well, it would only be 50 cents an athlete. And so there is a reduced price, or not athlete, I keep saying athlete, 50 cents a user. If you bought the Players Health Rehab application, the Players Health Rehab application is $500. It doesn't matter how many athletes you have. It doesn't matter. It doesn't matter any number of users that you have. So it's a flat $500 fee for the Players Health Rehab app. And then to recap on the COVID pricing, it's 75 cents an athlete, a user as a standalone. If you bought the Players Health Rehab application as well, it would only be 50 cents a user per year. So for the whole year, it's only 50 cents. If you got the rehab for the whole year, it would be 75 cents if all you wanted was the COVID form. Yes, so the COVID app on its own is only 75 cents a user per year. Let me see, before I move on, I just want to make sure that. And so one of the things, as you just saw, that I logged in using my 8 to 18 credentials, my profile is created. That is how easy it will be for parents to log in and create profiles for their kids. We pull the registration from 8 to 18. We create the athlete depending on how many kids they have within their activities that they've registered for. And then all they do is go in and they can update their profile here, this is all the basic information, height, age, year in school, contact information, which is insurance, primary physician, emergency information, which is really going into the primary emergency information, a lot of this information, and then all of the medical details. So if there are any medical conditions an athlete may have, allergies. And then if you want, we do have compliance. So any consent to treat forms, any concussion acknowledgement forms, which I know our Illinois schools, they have the concussion acknowledgement forms. So you can have all of that here. Parents can go in and fill out and do all of that as well, to have all of that be done in one place. You can download those later after the fact if you need to. But setting up and updating a profile, this is the parents' information. They'll be able to view and access all of this really quickly. And so if you look at the information here around access to a profile, this doesn't allow a parent to return an athlete back to play at any point. Our system only allows them to upload a medical clearance. So in the case of a concussion, for example, which Illinois state law, I think all 50 states require a medical clearance to return an athlete back to play. This is where they can take a picture and upload it. The athletic trainer at your high school or middle school can review it and then return the athlete back to play. But this platform ensures that the process is following that the protocol is being followed to make sure that that we're properly returning these athletes back to play. So we just made that process very simple, very easy. And then I'll walk through some of the medical related details and then the data, which is most important, that you all will start to aggregate as you start to see this used at scale. And so the best part about this platform is that the information that you start to gather as you start to report and manage the overall health of your athletes. At a glance, if I go in as an administrator, one second. I'm going to go in as an admin, and the way that this is all set up is to make sure that you have full administrative oversight over everything. You know the number of FOD reports you have. You know the number of athletes that have been properly returned back to play. You can see medical clearances of when those medical clearances was uploaded and by who. You can go back in and look at all of the incidents that are still outstanding and how long it's taken those athletes to return back to play. And then you start getting a ton more data around what's happening, age demographics, gender, all of this. Your medical professionals and yourself as an administrator are now viewing and able to see and access. If you want to see all the head and face injuries, you can pull it. If you want to see all of your knee injuries, you can pull it. And so all of this just allows you to have full administrative oversight around how the health is being managed within your organization. And then as an athletic trainer, the medical documentation capabilities are pretty much endless. You can go in, and let me go to my test. So when I go in as an athletic trainer, there's a number of features that I get access to. Number one, I'm always going to be able to see if an athlete has a medical condition at glance. So if a parent had put in, this kid has diabetes in their profile, I can go in and view whether they've said they had allergies. So this athlete has a bee sting allergy. And so that I'm going to be notified when I go in here. So also, we do have an electronic PPE or pre-participation evaluation. I know some of your organizations require, previous family health history, things like that. A lot of our high schools don't do this. A lot of our universities do, but we do have the ability to upload that. So here's the pre-participation evaluation, all your general health, all of that information. If they say yes to any of these questions, or the parent would be filling this out, of course it'll be visible to the athletic trainer, not the coach. The athletic trainer will be able to view all of this information. If a coach does have access to this, it's a very limited access of what they can view and see around a specific injury. And then really I'll go into the overall injury report and how easy it is to do that. When you add an injury, there's two types of injury reports that as an athletic trainer I'll see. This is that quick form. This, I'll give a scenario. Maybe athletic trainer is bombarded with a ton of athletes that come in at the end of the day. They only need to document high levels. So we're going to go in and say, the date of the injury is today. The time is now. Here's the team that the athlete is on. Side of body, which was left chest or left hand, type of injury, maybe potential fracture, mechanism of injury, impact with direct, indirect impact, or direct with a nut with plane surface, test, save. That is a quick injury report. They can do that from their phone. So as I said before, they may be in a rush, they may be on the field, and then when they get more time, they can go back in and add more details to the injury. So they can go back in and type in location, surface type. All of this isn't required, of course. But if there is a head injury, for example, say that we said it was head trauma, then there's a full cranial nerve assessment. We are working on the SCAT-5 to be loaded in for some of the athletic trainers. And then you start loading in all of your palpations, range of motion. This is this is SOAP note documentation. This is medical documentation that the athletic trainers need to document. So of course you got You have all of your ICD-10 diagnosis codes. You can upload photos, videos, pictures pertaining to it, or imaging. Say you got an x-ray or something, you can upload that. And then any treatment that was provided. So if I have treatment for today and we want to add cryotherapy, maybe I got 15 minutes of STEM. So I can put STEM 15 minutes, and I can put whatever setting it was on. All of that can be documented. You complete the report, and then all of this is fully HIPAA compliant and FERPA compliant. And so all of this information is now accessible for you to go in and view. I can see this injury. The system is going to let me know that the athlete has not been returned back to play. And so until that athlete has been returned back to play, it's going to show up. And then anytime a note has been changed, a file has been uploaded, anything, any type of rehab tasks that have been added, there's going to be a timestamp for it. So if I add a comment here, that automatically in real time uploads and updates. So all of that information is trackable. You'll always be able to track any time someone has viewed, changed, or updated a record. And then when it comes to managing participation, as a coach, what'll happen is coaches have very limited access, as I shared. So the coaches will be able to view their participation status of their injuries. This doesn't have any current injuries right now, but I can go in and let me see if I can go back to my Dave Beckham example, and I can view this injury, and then it's only going to give me the high level date, who is documented, their participation status, time. Like you saw a night and day in terms of what the athletic trainer could see and then what the coach can see. So coach has very limited access to an athlete's medical information. They can only see whether that athlete can play and what injury it was, a left knee. But all of the other SOAP note documentation and everything, the coach cannot see. The coach can send messages to the system. That's pretty much it. And the coach can document an injury themselves, only as you can expect, that injury report for the coach is the very simple form: date, time, team, side of body, left, elbow, test. That's it. So the coach really doesn't have a lot of administrative or medical viewing of the actual profile. Coach can go in and view all of the data as well for his team, his or her team, and can go in and match all of this. So the coach has access to view it. Some of our, a lot of our universities definitely have coaches logged in. Some of our high schools do. But just to give you an understanding around how many high schools Player Self supports today, we have close to, I'd say close to about 700 high schools now we support on Players Health right now. And so this is not foreign to us. We're used to it. And in terms of implementation, there's no implementation too large or too small. So definitely don't want you all to think that this has to be very large organizations or large high schools or anything like that. And so I'll pause because I know that that was a lot of information. For this, if there's very specific questions around what you all want to see, I know your athletic trainers would be directly interacting with this the most. Know that this is available. It's $500. It doesn't matter how many athletes you have. It doesn't matter how many coaches. We'll set everything up. All we need is the integration either via 18. If you're not using the 8-18 registration, we would just request the rosters and then we'll upload those. And then your athletic trainer can go in and manage everything easily. I know this was a lot of information. Definitely want to make this digestible. And so I'm going to double check and see if I have any questions before we sign off. And perfect. Abigail was really kind of providing some context for everyone on the chat. It pertains to the rehab 8-18 integration. And so If there's any questions, if you all have any interest to learn a little bit more, don't hesitate to reach out either to myself. I have my email here, Tyrre at Players Health, or oh, 1 second, or reach out directly to Abigail or Kim over at AH18. But my name is Tyrre Burks. As I said before, again, we're here with Players Health. Really excited to support you all this summer and this fall. Want to help you all get, doors back open, get kids back to activities in school. Any way that we can support you with setting up your policies, putting together your technical infrastructure, we're here to help with that as well. Talk to you soon, and really looking forward to connecting.